I first visited New Delhi when I was 13 years old. That year was said to have the coldest winter in 8 years. But that could not dull the enthusiasm of a small town boy who had seen India's majestic capital with its sights, sounds, wide roads, huge lawns, monuments, structures of power, and iconic food for the first time. What did, however, prove to be a dampener in an otherwise brilliant trip was my father's plan to get his family a full master health checkup at the most respected medical institution in the country, the All India Institute of Medical Sciences, an institution that treated prime ministers and finance ministers and founders of the biggest businesses in the country and the person on the street most affected by their policies and products. We made the rounds of the hospital for 10 days. Not once, not even once were we able to get past even the registration queue. The crowd was unbelievable, and yet people waited and jostled and pushed their way in. It strangely gave us a sense of our privileged existence and also the crying need for more healthcare institutions in the country. My father thankfully dropped the idea of health checkup and we had a really memorable trip. Over the next few years and later as a student of Delhi University, I heard a lot of stories from AIIMS. Two kinds of stories. Of miraculous treatments by diligent, dedicated, best-in-class doctors, and the other kind of long waits that often assisted fatal diseases in claiming the lives of the patients who waited. Last week, my colleague and ET's pharma ace Teena Thacker wrote a story that told me that the situation in AIIMS has only gotten worse. In her story, Teena cited a parliamentary committee report which spoke about an acute shortage of staff at the institution, a growing number of vacancies, and a gross underutilization of resources. Resources which are in themselves quite inadequate. So, for this episode, I spoke to Teena, who in turn spoke to a senior doctor and top official at AIIMS to bring you the story of India's biggest hospital and its chronic ailment. It's Friday, the 21st of March. I'm your host Anirban Chowdhury, and this is the Morning Brief. First up, Teena. Hi Teena, very warm welcome to the Morning Brief.
Hi, thank you for having me.
Tell me, let's start by you describing to me the crisis that AIIMS is facing right now.
So we all know that, AIIMS is the country's premier health institute. But unfortunately, AIIMS is reeling under acute shortage of staff. We have reported a few days back the data from the government report, which says that there are 430 posts of doctors and over 2,000 posts of faculty members lying vacant here. And this is a parliamentary standing committee report, which has also reported that AIIMS is facing shortage of staff in various cadres. So, for example, 34.8% of the sanctioned faculty posts are vacant. The proportion for non-faculty is 16.29% of the sanctioned strength. And similarly, there are 434 vacancies, which is 37.48% of the sanctioned strength for senior residents. And this, I'm talking about non-academic. And 113 vacancies, which is 46.89% of the sanctioned strength for junior residents.
So it means that there is a shortage of doctors, of teachers, and of students.
Yes.
That's what it means in a nutshell?
Yes, the problem is immense.
Is this level of crisis or expense of crisis or degree, is it unprecedented?
This is a supply and demand issue. The market forces of supply and demand in healthcare sector would always determine the flow of doctors or healthcare professionals to better avenues. So when AIIMS was established, it was established as a tertiary care hospital, like a referral hospital and for research purpose. However, over the years, what we have seen is that the status of tertiary care has been diluted. We see a lot of patients which require primary or secondary care coming to AIIMS for the treatment, which could have been handled at a secondary level, at a primary level. So this has all increased the patient load to a significant level. It's not that government is not doing anything. It has established AIIMS like institutions, but they are AIIMS like, and they are not AIIMS. So we see a lot of influx of patients coming from different states. And if we had, I believe that, if we had strengthened primary and secondary care at the district level, at the state level, these patients would have been taken care of at that level only. But, we see a different story. So I think, to my understanding, we should have a policy on patient load management, strengthen the budget, and primary and secondary care centers have to be strengthened to ease the patient load. So I think a survey can probably be done to see where's the maximum load coming from to AIIMS Delhi, and then strengthen primary and secondary care at these places. So it's a slow movement, but I think we'll have to do something about it if we, need to ease the load at AIIMS Delhi. So, we'll have to look at the perspective and the reason. So India saw a boom in healthcare when we saw a lot of private hospitals coming in. So when they came in, they offered increased compensation to experienced doctors. And the doctors, of course, obviously, they happily chose to join the corporate or the private hospitals. So, and we all know that the faculty at AIIMS is like top notch with their expertise. So, many started leaving, they still leave, and many left that time as well when they were offered better facilities, infrastructure, and compensation.
How much better are we
So,
talking about? Compensation?
depends on the expertise. So if a doctor at AIIMS who has spent like 20 years, obviously he'll get much better package vis-a-vis a doctor who's in some other hospital, a small hospital, and may have experience of 30 years. AIIMS is always considered like a top-notch hospital. But the problem is that, the poor and everyone cannot afford those. Even the middle class cannot, to a certain extent, afford the corporate hospitals. So basically, it's a structural problem and a fundamental issue which has to be dealt with. So the challenge is, I think, how to address the problem at the government hospitals and provide healthcare to people.
Describe to me how the shortage of doctors, etc., have led to more harrowing times for patients, who already face quite a tough time in AIIMS anyway. But how
Mhm.
is it? How has that worsened?
Yeah. So, we see a total mismatch when it comes to facilities for patients and their attendance. If you take the OPD at AIIMS is from like 10,000 to 12,000 patients every day. And this includes all those which will probably require just a consultation, which means that, you go to the hospital and you just been prescribed a medicine and you go. And those who may have to wait longer to get treatment, like, maybe a surgery or something. Now these patients, of course, they cannot afford a hotel. So there are some rest houses around the vicinity which have been established by the hospital. But it's strange that the total capacity is just 700. So there is a huge gap that we are talking about.
So obviously, the kind of money that is pumped into this institute is not enough, right? I mean, the latest budgetary allocation, I think, increased to 677 crore rupees.
Mhm.
And there are some reported additional figures of 300 crore rupees to make it an AI driven world class medical facility. Now, first of all, this is inadequate, right? Because I think the
Mhm.
number quite a few years back was 500, and from there to
Mhm.
677 is nothing. And
Mhm.
also, where is this money going?
So, I've been covering it for a very long time now. And I know that about like 20 years back or 25 years back, the budget for AIIMS was rupees 500 crore, as you just mentioned. Though, if you compare it, it's much better than any other government hospital. But, it's not a massive jump, so to say.
Hmm.
So, this is probably not adequate to meet the demand, as there are now new diseases which require research work. Hence, the funds are needed. So remember, AIIMS is just not a referral hospital, it's also research. So, a lot of money is needed, or a lot of funds are needed for these research work. Unfortunately, the other side of the story is, as mentioned by this panel in the report, which says that the utilization of budgetary allocation at the AIIMS New Delhi is a matter of concern, because they saw in 2024 and 25 the institute utilized only 81.96% of the revised estimate till January end. So that's the
Okay.
another area of concern and needs to be handled too. And you talked about artificial intelligence. It's understandable, but I think it's a very nascent stage and
Hmm.
a lot is needed to be done.
Tell me the three main solutions that the panel has suggested.
So the panel has, because the AIIMS comes under, and all these central government hospitals comes under the Union Health Ministry. So they have asked to provide competitive compensation packages to attract qualified candidates. And it has also asked to prioritize immediate filling up of all vacant faculty and non-faculty positions. And that has also said AIIMS should implement a streamlined recruitment process, including targeted outreach. So, and also it spoke about the long waiting time for urgent treatment of even critical patients. So the panel has said that the ministry should explore the possibilities of constructing another AIIMS in the National Capital Region close to New Delhi. So, another suggestion which has been given by the committee is a comprehensive review of the AIIMS residential redevelopment project, given its extremely slow progress that the committee observed. And there are recommendations to expand the efforts to address patient overcrowding and improvement in services, including providing temporary shelter and enhancing patient convenience through various facilities and streamlining appointments via online system. So these are some of the solutions and the recommendations which the panel has given.
It's been about 2 3 days to your story. Do you hear of any reactions from the health ministry? How are they looking at the panel recommendations? Are they acting on them?
So they always say that it's important for them to know and understand, and when it comes from the government itself, like the members are the members of Rajya Sabha and Lok Sabha, so obviously they have to take some cognizance. But we only have to see, and time will tell how they respond and how their rigor and how they cope up and they deal with the issues which are just there out loud and open. So we'll have to see, and only time will tell how serious they are about helping people and strengthening healthcare in India.
Next, Tina spoke to a senior AIIMS official for an insider's insight. He didn't want to be identified, so we used AI to generate an alternate voice. Tina asked him if the situation at AIIMS has indeed worsened in the last few years.
Things have worsened in last 2 3 years much more faster than it was earlier, because you see, there has been a downfall in the societal values, and any organization or institution will have an effect on the functioning of the society as well. But in last 2 3 years there have been a rapid downfall, much more than what should have been there.
Earlier this week, we had reported how country's premier healthcare institute, All India Institute of Medical Sciences, is ailing without enough manpower. But sir, do you also think that there is a lot of bureaucracy or say interference from the government, in the decision making, which probably leads to the crisis?
I would say yes. Over the last decades, and more so in last 2 3 years, involvement of the government, or interference, if I can use that word, has increased. There is a full-fledged OSD sitting in director's office whose only job is to take care of such patients who are referred by our politicians. And such interference, along with other factors which I am coming to, has definitely led to downfall in our standards, or you can say decline in our work culture. Some of our senior doctors, who are as such excellent clinicians and teachers, they are more busy in running behind politicians and senior bureaucrats so that they can get some additional assignments, awards, memberships, foreign trips, anything, rather than giving their time and energy for the patient care, medical education, and research for which they are here. And seeing them, some of our middle level faculty are trying for some or the other administrative assignments within the institute to enhance their importance or nuisance, if I can call it. They are clamoring to become professor in charge, officer in charge, chairman, coordinator, something or the else. And our honorable director is willing to oblige. And third reason, there is inadequate physical infrastructure and the acute shortage of regular support staff to ensure that the good doctors, they should be kept free from such issues and they can concentrate on their clinical, teaching, and research responsibilities.
And how long can be the wait, sir, for someone who has come from, say, Bihar or from any other state and has been referred to AIIMS for a major surgery? Since you've been there, have you seen that the wait is so much like, that is into, running into months?
I would say years. For certain procedures, it could be few days or a month, whereas for others, like say neurosurgery or ENT or even some of the specialized cardiac surgeries, it would run into 2, 3, 4 years also.
Sir, do you think that, things could have been handled better by the government? Do you think that the government has to be blamed to a certain extent?
Well, I would not say that. There are no easy answers to this, what you are saying. But as far as AIIMS is concerned, we need to improve the things. So the first thing that we need to have is perhaps a very large general hospital as a point of first contact, which will act as a filter from where only such patients who are genuinely needing expertise of our specialized and super specialized faculty would be referred. Then second thing is that government has already taken action. It has established 22 AIIMS across the country in all states. But these referral AIIMS, they need to be strengthened so that the patients from these states do not feel the need to come to AIIMS New Delhi. Thirdly, at our level, the available facilities in the institute need to be utilized better. Several of our investigative and therapeutic facilities, including very high-end machineries and equipments and operation theaters, are functioning, say, about 7.5 hours a day. Why can't they function 18 hours a day in shifts like in corporate sector?
The equipment is not a problem at AIIMS, sir?
No, not at all. The government, as far as the budget is concerned, government is quite liberal. We have sufficient number of equipments. Of course, again, if you see from demand-supply mismatch, there is a long waiting list. But is a long waiting list only because of large number of patients and less of equipment? I would say no. Because the second thing is that the use coefficient, utilization, can be improved. We can use these equipment for a longer period of time than we are using as of now.
What about the funds, sir? I see that, the funds have increased, budgetary allocation has increased, gone up. But do you think it's enough for research work and for the facilities that we have at AIIMS, sir?
Well, you see, as such, the budget allotted by the government is not really less. But at the same time, you're also right that funds allotted by the government are not being utilized properly, and approximately 1/3 of our grant in aid for capital assets budget was surrendered last year. Now, this is because the departments don't have freedom to buy the consumables and machines that they want because they consider it as a good quality. Why? Because of administrative delays, reptipism, insufficient support manpower of the store section to help in purchase process, and frequent and unrealistic objections by the finance division. And on the other hand, we have incurred several wasteful expenditures. Though there are several cases, I'll give only 2 examples. About 10 crore rupees have been spent in destroying, I'm using the word destroying, our residential area community center by constructing a very big hall-like temporary structure, but it is lying vacant and unused for the last 1 year. It was told that it will be a patient waiting area. But tell me, which patients will wait 1.5 kilometers away from OPD, emergency or inpatient? Second example, about 1,000 high-end cycles costing maybe 10,000 or more each cycle were purchased, total cost of 1 crore plus. And it was said that campus will be vehicle free. But first, they stopped getting rested for about 6 months, and then they were gifted away to the staff for free without any accountability. And now you don't see any of those 1,000 cycles. And the funny thing is that every such wrong decision, the director says, I have been ordered to do so by the health minister.
So, sir, you've just told the problems that we have at the country's premier institute, and we have also seen in the report. What do you think are the out-of-box solutions that can solve these problems to a bit, maybe?
Well, Teena, before I come to possible solutions, I would like to touch upon one very important point, which was there in your report, but which you have perhaps missed, about shortage of doctors and other staff. Lal, in this regard, I would like to say that large number of faculty, resident doctors, and support staff posts are lying vacant. And the number of vacant faculty posts is more than 400, can you imagine? Out of 1,100 to 100 posts sanctioned, about 35% of the total sanctioned posts are vacant, and there has not been a single advertisement for faculty recruitment in last 2.5 or 3 years since the new director has taken over, for reasons better known to him. Okay, it is now only recently that our honorable health minister has possibly told or reprimanded him for holding on to that now the advertisement is likely to come in next 7 to 10 days. Besides, as far as manpower is concerned, I would like to say that besides doctor, we need a lot of support staff who work in the background but are very essential in efficient functioning of the hospital. Here, I would like to say that when we request the government, the posts of doctors are easily sanctioned, but the government is ruthlessly miser in sanctioning the support staff, with the result that we are working with incompetent contractual data entry operators or other people for most of the administrative works. And if I'd like to summarize, I would say that we do have some shortage of physical and manpower infrastructure. But as far as funds are concerned, the government is giving us sufficiently. What is really required is to restore our work culture, which has been systematically destroyed by the current leadership.
The All India Institute of Medical Sciences, a 69-year-old facility, has always been both things: a leveler, but also a divider on the lines of class, reach, and power. And now it seems to be more of the latter, while also suffering from a chronic disease. It's a classic case of doctor heal thyself, and it requires perhaps an overhaul of how healthcare is treated in India, as a subject, a matter of reform, and an item in the fiscal budget. When and if that overhaul will happen remains to be seen. That's it for today. You were listening to this episode on The Morning Brief. It was produced by me and Vinay Joshi, sound designed by Amrit Reddy. A new episode of TMB drops every Tuesday, Thursday and Friday, wherever you get your podcasts. Keep listening and have a good weekend.